My exam date and everything. Is that okay? Okay. Actually, my exam was on 25th September, and I was the fourth person of the day, and my exam was started actually 15 minutes earlier. I mean, for checking purpose, like name exactly I forgot. Anyway, just give me a minute. I will just bring out that one. Kids and everyone, then big difficulties. Was Dr. Amanda Badam, and other two was Dr. Richard N.J. and Dr. Radhika Dara. Okay, my exam was started with this question I'm sending now. This is my first question. As actually haphazardly I wrote, please bear with me. It was not so, organized way I wrote. Actually, my case was adult asthma, first case. You can see that Simon White is a 32-year-old, actually the landscape designer, who came to you with his co-worker called Perry, because he developed sudden shortness of breath and lightheadedness while he was working on the design on new place. Okay, and you are in a local small 4-bed hospital by GP setting, with primary facilities like nurses. Tertiary hospital is 45 minutes away from the place, and actually first they were asking me how will you approach with this case. Okay, and then I started according to, I mean, everyone, you know all the things, I think better than me. uh, Actually I started like I thanks panel by their name, and I was saying that I will consider this patient as an emergency patient due to his sudden shortness of breath and lightheadedness, and I will check his hemodynamic stability, and I will, if he is unstable, I feel, then I will take him to take him to the treatment room and manage with the DRS obesity protocol, and I will immediately call my supervisor and call practitioners. Then I will tell to receptionist to call 000 to call ambulance. I will transfer the patient immediately by trolley, and while doing my primary survey, I will take focused history like uh, primary survey DRS obesity. According to A part, I just said like at the transferring time, I will talk to him, and if patient is talking clearly, that means airway is patent. Please, reply in between if you are really unable to hear or any problem. Please, stop me, because as we are not interacting by talking, then it will be a bit difficult. But anyway, if you are not able to hear or any difficulties, please let me know. Okay, then if I see the patient is talking clearly, I will take. I mean, I'll think that this patient is airway is patent and everything is fine. Then I will go for breathing and ventilation. I will look any sign of increased work of breathing, intercostal indwelling, subcostal recession, use of accessory muscle of respiration, any asymptotical chest movement, and then it was by look, and then by listen I will quickly check breath sound with stethoscope for abnormal lung sound like stride or with bronchi and crackles, and I will feel the air movement by touching the chest and ask the practitioners to check our respiratory rate and attach SpO2 device to check the SpO2. And then in the C part, I was telling that I will check pulses for rate, rhythm, and volume, blood pressure and I'll check the pallor sinuses in the skin and ask practitioners to get IV access and ECG. And actually I was not very fast, and I was trying to tell this, I mean, danger part. I just said like I will assess the patient with ABPU approach and keep the crash cart beside my patient and check blood sugar with a glucometer and keep the defibrillator side by the patient. And when I just try to say about the exposure, they said me, okay doctor, your time is over, we'll go for the next question. And then I couldn't complete my other focused history like normally we should take. That was my endpoint of that history. And then they said that actually like some finding, like respiratory rate was like this. I will send you some findings. That actually this is organized way. It was not like this. It was actually if you think this one, this is the correct one. Actually at last I found, actually finding was like respiratory rate was 30, SpO2 93, respiratory pulse rate 110, BP 160 90, COVID negative, nasal congestion was there, mild distress, shortness of breath, and chest tightness, bilateral wheezing plus crackles also was telling. Then was asking what is the provisional diagnosis and differential. Okay. Then I was starting with the provisional that as this is the finding, I will treat actually I started with what just a minute. Then I started like this way that I will share all my findings of history and physical examination with my supervisor, and I will thank the patient, and I will explain that this is a moderate to severe asthma, and I will start with giving salbutamol 12 puff using MDI and spacer. If there is a poor response to the initial dose, then I will add ipratropium to each of the 3 further doses of actually salbutamol over the next hour. Then I will arrange urgent emergency assessment again. I will check again and reassess every 10 to 20 minutes after third dose and check oxygen saturation. Then I will add actually I said that steroid. If he is not able to tolerate orally, then I will give injection hydrocortisone. Okay, and then they were saying actually, and then I added actually other thing also, that non-pharmacological factors like avoid anyone smoking around this patient, crowded area, dust, mite, healthy diet, good hydration, hand hygiene. Okay. Yeah. I said so. Yeah, I forgot to tell you. Actually, it's long time after the exam. I said that oxygen I will start because it is below 90. I mean 93% of oxygen. I'll give oxygen. That also I said. Then, if oral he was able to tolerate, then prednisolone 1 milligram per kg I said, and then if not, then I will give hydrocortisone. Yes. Okay. Then I said other things like non-pharmacological, other things like hand hygiene, good hydration, healthy diet. Then I'll give one short asthma plan for to educate the patient, and uh, I'll explain the things that how he should continue. I mean, I'll check the health literacy. I mean, everything I said, but I will keep the patient another 3 to 4 hours. I said that because patient was as severe like asthma. I said. Then after that they were saying, okay, doctor, you have found this thing, but then they gave me actually like patient feels better after 1 hour, and SpO2 was 98%, respiratory rate 18, no distress, no wheezing, patient wants to be discharged. How do you manage now? Okay, and then I said that I will actually check the stability again. I'll check the condition of the patient again, and if he is all right, and as I found this finding, and I will provide a written 3-day asthma management plan and arrange review within 48 hours. I will check PAFR and special technique how he is able to do or not, and I will inform to community asthma nurse to make sure that everything is going well, right? And I will gently tell him to avoid smoking and triggering factors like fumes, dust, pollens. Then before leaving the clinic, I will uh, talk to my supervisor, and I will inform him about all the things, and I will give another 3 days of prednisolone with and I will check other like salbutamol is there sufficient or not. Then I will discharge. After that, actually, they didn't ask me any cross question. They just said that was okay, doctor. We'll go for next question. But if you want, you can take some break. I said no. I'll just drink sip of water, and then they started another one. Anyway, is there any question, please? My exam was really a straight cut. Like they didn't ask any cross question. Just this way only. Normally, what the way that way they proceeded.
You didn't mention anything about the blood pressure or giving adrenaline to the patient, doctor?
No. Actually, I didn't mention anything about the blood pressure also, as the patient was in like just few hours. He was working outside and came here. I was thinking as a stress or something. I didn't mention anything about that.
Okay, thank you.
Welcome. Is there anyone, please? Please interact. It will be fine, because otherwise I am thinking maybe you are not able to hear me, because I don't want to take long time from you people now.
Hello, doctor.
Yes,
Yeah.
yes.
So, congratulations at
Thank you.
first.
Yeah.
So, I want to know that if they ask anything from your CV,
Hmm. No,
regarding
no,
CV or anything about
no.
your practice, anything particulars.
Nothing. Just two question. Oh, I forgot to tell that one. Just first, when they started my exam, they just asked two question. Are you in Australia or outside of Australia? I said I am outside of Australia. Did you visit your practice? I said no. Did you do any? Oh, with this question, I was asking like any observership you did or not. I said no. I am totally outside of Australia, and I am living in Norway. it's not possible for me, I am here. Then they started as usual. They didn't ask anything about CVs or any other workplaces and what they're, how many doctors are there or
No
something.
CPD or anything, nothing.
Nothing.
Okay.
Nothing.
Thank you.
They didn't ask anything. Yes. Is there anything else? Okay. Then we'll proceed for the second question. I got my little bit arranged question one.
Emergency cases, we have practiced like this, that may I know my patient is stable or unstable? Do we have that
No.
opportunity to ask this thing, or just?
No, I didn't ask. I just said directly that as this patient having shortness of breath and lightheadedness, I'm thinking as a emergency, and I'll take the patient to treatment room. Immediately inform my supervisor, practice nurse, and receptionist to call ambulance. And management part, I forgot one more thing. Actually, if he is not feeling better, then I will call to hospital and send to hospital. I just mentioned this thing. But immediately they say that patient is fine, you don't have to worry, that vitals also given normal. Then I share. It was not straightforward. They asked this way that how you will approach with the case. Then given some finding, last what I sent this finding. Then how what is your differential and provisional diagnosis, and how will you manage later on. Vitals and everything given normal. That also I can send you. I think that is also that finding was like this.
Hello, doctor.
Yes.
Hello, doctor.
Yes, please. Please.
After the patient,
even
if he is okay, transfer to hospital.
No, I didn't send to hospital. I didn't
You don't send.
Please tell me again.
Okay.
No, I just mentioned this thing that if patient is not improving at all, then I will send to hospital. But I have given first salbutamol, then added ipratropium, and then prednisolone orally if possible. I mean, if he is tolerating. Otherwise, I will give hydrocortisone. I said this thing only.
Okay.
And I said other thing also, like I will observe for 3 to 4 hours, and then within that, if anything problem, then I will proceed accordingly.
Thank you.
Thank you so much. Yeah. And this is actually last question about the asthma case. The patient feels better after 1 hour, SpO2 to 98%, RR 18, no distress, no wheezing. Patient wants to be discharged. How do you manage? Actually, I just told everything like due to about the safety netting, how is understanding about the situation, is he having all the like salbutamol sufficient amount. Then I was giving 3 days of prednisolone again, and other like non-pharmacological treatment like lifestyle modification and things. I said those, and they said it's okay. Is it fine? Okay, then next question I will go. Next question was AGE case. And this is the question I'm sending.
Okay, we can go to second. Okay.
Yeah, this is the one second. Actually, it's AGE case. Soraya, 3 years old girl, brought by mother with vomiting and diarrhea for last 48 hours. Attending daycare 2 days per week. Vaccination up to date. Just this much I was able to remember, and asked me to take further history. Okay. Then actually I started like this, that everybody knows the starting point, like I was thanking panel and introduced myself, greet both of them, and check the stability of the child by pediatric assessment angle. Then, as Josie was having vomiting several times and diarrhea, I was just saying that I will transfer the patient to treatment room, and will a good report and issue confidentiality. Then sensitively, no, actually it was not needed that time. Then I will explore ideas, concern, and expectation. Start history with open-ended question. Then I was starting with the vomiting question. Like I want to know since when that vomiting started and how many episode was there. Was it gradually or suddenly? Was it projectile or not? Is it mixed with food particle or blood or anything? Was it diurnal, nocturnal pattern? Then I was telling about color of the. Was there any? I mean, bile, the vomiting. Well, color was what, like it was like greenish, or what about the consistency, volume, odor, everything. And I was asking about that, was it related to food or anything, or related to the daycare, and was how long after the feeding it was happened, anything makes it better or worse, any excessive drinking or eating, then triggered, what was the actually triggering factor for vomiting and things, and was there any trauma to head or any injury, any other part of the body, is anyone sick at home, like other things, like as you all the time you know better than me, because what I told I will be not able to recall everything. And I was asking even recent hospitalization, any child having any other, I mean in the daycare, any child illness was there or not, anybody sick at home. Then I was asking like well baby question, is the child active, irritable or drowsy, she's feeding well or sleeping well, growing well or not. Then any change in the like piece, like any color change or not. Then was the child toilet trained or not. Now how many nappies used, is there any like smelly diaper or something. Then any like differential question, I was actually not able to finish all the thing, like I asked rash is there or not, neck stiffness, chest pain, cough, shortness of breath, any ear pain, ear pulling, any during crying, is the child pulling ear or not, any discharge from the ear, color, consistency of volume, and any foul smelling or not, any abdominal pain, any distension, any constipation, any headache, nausea, vomit, and vomiting already was there, I didn't mention afterwards. Then any dysuria, polyuria, like any actually I asked about nappies changed, how many or not, I mean how many nappies changed, any soiling in the nappies by any chance, I was asking. And then vaccination was, I think, up to date. Just 1 minute. Something about the vaccination was, I think, up to date. Yes, vaccination was up to date. And did you mention after stabilizing child based on primary survey, I started studying? Yeah, after that, not primary survey, actually I checked with pediatric assessment triangle, then started taking history. Okay. And then I couldn't complete all the other things. Then they said, okay, doctor. Okay, thank you. Then they said, okay, doctor, it's okay, we'll go to next question. I couldn't just finish total history, and then they said that way. And they have given some finding like this. I already sent in the chat box that mild fever for 2 days, no blood or mucus in the stool, vomiting was there yesterday but not today, loose stool 6 episode today, no history of outside food, no history of contact with AG in daycare. Then I was asking, how do you assess the dehydration of the child? Okay, and then I was telling actually I will check mental status of the child, CRT, shrunken eyes, skin turgor, oral mucosa, urine output. I'll check with the diaper, like how many diapers they change and was it full soaked or not. I was saying this way. And then also they are asking, is there anything? Then I was just waiting for some time, and I was saying actually that maybe I'll check, I'll do some, no, actually what I said afterwards, I think this much only I said. And then they said that actually, I mean, they gave some other finding, like I said, like sorry, in between that they asked me, I think, some physical examination. Okay, how will you proceed with your examination? Then I said this way that I will follow the standard protocol, tell every step to mother and assure her that I'll be gentle while being examined, and I will stop examination if it is uncomfortable for the child or you. I will start from the less distressful area to more distressful area. My focus examination will be, like I said, especially checking dehydration level, abdomen, respiratory system, and relevant, I said, some ENT examination only. And I'll check the growth chart also to compare with the previous one. Then my office test will be blood sugar by glucometer and urine dipstick test. Then other thing, when I was supposed to tell, that time they gave me this finding, as I said to you, that tired, child is tired but alert, temperature 36.8, mild dry mouth, skin normal, CRT less than 2 seconds. What is your provisional and differential diagnosis? Then I said actually I just showed that my clinical judgment, and I said that as the child is having like normal vitals and everything, first I am thinking as acute gastroenteritis, and other differential will be like food poisoning, urinary tract infection, like upper respiratory tract infection like tonsillitis, pharyngitis, sinusitis, then lower respiratory tract infection like pneumonia, otitis media. Then I said sometimes maybe food poisoning. And then they asked me that, okay, how do you manage this child with this finding and everything? Then I was actually started this way, that I will share my findings about history and physical examination. Everybody you do so same thing, everybody same. I just involve my supervisor and everything. I will explain to the mother about the history and examination, and then I will explain the diagnosis, that this is a mild to moderate, actually mild to moderate dehydration following that what is that actually? Gastroenteritis. Then actually I said that please don't worry, it is actually treatable, and I will give actually rehydration saline, like in the clinic, like 10 ml per kg per hour if she can tolerate. If not able to tolerate orally, then we need to transfer her to hospital for further assessment and management. Then I said that according to my management, that non-pharmacological I said first. I will tell to improve hygiene, then hydration, bowel habits, encourage breastfeeding and formula feeding, like if the child is on, continue normal diet but avoid sugary fluid and other food containing fruits, then stop like sending to daycare or school. I mean, actually daycare until full recovery. Identify and manage contributing factor, like anything in regard to this, then that should be managed. Then discuss about hygiene and how to clean the how to clean the child after pooping, and encourage actually good fluid intake and regular voiding. Discuss any like actually in that moment I just said, and if vomiting was there, I mean if it is really more, then I said about the ondansetron 0.15 milligram per kg per dose, and I will review the child 48 hours. In that moment they said it's okay doctor, it's fine, we'll go to next question. And then they actually they are asking actually another question, I forgot. I mean management I said this way, and then they say that again I forgot exactly how one more question was there. Just give me 1 minute. I think I don't know why it is not opening. Just give me a minute, I'll just check till I send some. Say I forgot exactly that question. I'm so sorry. No, I didn't. Actually, I just gave as vomiting was more, and because of that, I said if really more vomiting and not able to take orally, then I will give this ondansetron. Another question they were asking me, I don't know where I wrote. Just a minute. Okay, actually they were asking at that time that how will you assess dehydration level of the child? Again this question they were asking, and how mother will understand the severity. And exactly I cannot remember what I said, but if again I repeated those things, like I'll check the CRT, nappies, I mean how many nappies changed and how much it is soaked, and how frequently it was changed or not. If there is no, I mean not changing many nappies, then I will explain mother that it is a sign of dehydration, that you should be considering that it is emergency, you should go to immediately to hospital. And then they said okay, it's fine, thank you, we'll go to next question. Do you have any question now?
Doctor, you mentioned any antibiotic or anything?
No.
Okay, thank you.
I just, as you saw this, actually I sent the finding, right? According to this finding, I said no, I'll just I diagnosed as mild to moderate actually AG, and then they said okay. Afterwards, they were asking this question only. I mean, main focus was there, that how you will make them understand that this is as I said the question again, I'll tell you. Sorry. Question was that how will assess the dehydration level and how mother will understand the severity. Okay. Their main focus
Why
was
transfer the patient, doctor?
yes. Can
Why
you
you
repeat again?
transfer patient? Why you transfer the patient?
No, as the child was having, you see, the question was, child was having vomiting and diarrhea for last 48 hours. Due to that, I just, for safety purpose, I sent to treatment room. I didn't send to hospital or anywhere, just treatment room, and I was taking further history. Okay, it is just for safety purpose that I am, as the child is vomiting severely, I mean, last 48 hours plus diarrhea, I will check the stability by pediatric assessment triangle, and then I will just keep in the treatment room. And because child is vomiting, we might need to give, I say that ondansetron, it might be we need to give in IV form, and we might need even to give IV fluid also. That was the reason actually I said I don't know, but they didn't give me any other recommendation or anything, and I will show you that also, that they have given really nice comment on my exam and everything. But I was not so hurry. I was just slowly telling everything, and they were also giving me time that okay, but like 3 minutes history, people are saying I didn't get all the cases 3 minutes. Maybe some cases was 2 minutes, some cases were 2.5. 3 minutes, I think first question, first asthma case I was getting, but I couldn't complete it in 3 minutes. Is there any question? Okay, then we'll go to next question. Third question was pneumothorax. I'm sending all together in the file I have. Yes, this is the case actually. Luke Morris, 29-year-old. 3 days ago, he had COVID booster taken actually, and now came with right-sided chest pain. You are in a 10-bed community hospital, X-ray and pathology available. Tertiary hospital 2 hours drive away. At 10 years, had a history of fracture radius, and he was non-smoker. Then was asking actually approach, and same way like first case, he was telling same way, but I didn't go to DRS ABCD immediately. I just said this way that okay, I will take to actually I was telling that just a minute. Where is that? Sorry for disruption. Yeah, actually I was telling according to that normal way that I will introduce myself, greet my patient, ensure confidentiality as the patient came with actually severe right-sided chest pain. I will consider the patient as an emergency patient and transfer the patient to treatment room by wheelchair with the help of my supervisor, and I will inform my supervisor, stabilize him, and after stabilization I will proceed with the history and asking further question about the chest pain. As it was only chest pain, I didn't go actually DRS ABCD in this case, because already I told one case with DRS ABCD. I just followed this way. Then I started Socrating chest pain. I was asking according to the pain, how is the pain scale? If it is really more, then I will offer painkiller after excluding pain. Allergy to painkiller. Then where is the exactly pain, and is it central or peripheral? Is it sudden or gradual? Was it continuous or intermittent? Yeah, if not continuous, then how often? Then is the severity is increasing or not? Is the pain like heaviness, tightness, or pressure like over chest? Is there radiating to jaw or arm? Is it affecting like day-to-day life? Then associated symptoms, I was asking like, is there any racing of heart, palpitation, lightheadedness, dizziness? Was it first time or not? I mean, is it first time or not? If not, then how often and how many episodes so far? Then I was telling that, asking that, is there any, I mean, pain increasing with exertion, coughing, breathing, or changing posture? Is it relieving by rest or not? Any triggering factor like trauma to the chest, any nausea, vomiting? And then I was asking about shortness of breath history, that what is the duration, is it for first time or not, same way like sudden, gradual, continuous or not, and then is there any aggravating factor, any allergies, and then associated some symptom I asked like sweating, nausea, vomiting. In this point actually, when I just asked associated question this, then they said, okay doctor, we'll go to next question. And next question they asked me, after giving some finding actually, I gave here that in the sitting position he has sharp stabbing chest pain but not altered by posture. Pulse was 70, blood pressure 125/75, temperature 36.6, BMI 22, respiratory reduced chest wall movement in the right side, then hyperresonance also, and little bit absent, I mean absent breath sound in the right side. Then they are asking that what is your differential diagnosis and a provisional diagnosis. Then I was telling actually first, as X-ray I didn't send, X-ray I'll send you. X-ray like this, not exactly this one, but like this. Okay, did you get? Okay, and actually I was just explaining things like how it is, like it's a X-ray of chest, PA view, and I was telling about this lung field and postophrenic cardiophrenic angle and everything, and I was telling about the hyperlucency of this right side of the chest, and then I was telling that okay. No, in this case they didn't ask me the actually examination. Okay, and then actually I was telling that I will actually I say that as there is no tracheal shifting, but it's a huge pneumothorax, and I didn't say it is a tension because there is no tracheal deviation. Then I say that it is as my provisional diagnosis is a large pneumothorax, and other differential will be like maybe spontaneous or traumatic pneumothorax, pneumonia, pulmonary embolism, then acute coronary syndrome, acute aortic dissection. Actually, I said non-respiratory and respiratory. Respiratory, I said like this pulmonary embolism and pneumothorax, like spontaneous or not, and pneumonia. But non-cardiac, non-respiratory, I said like acute coronary syndrome, aortic dissection, acute pancreatitis, costochondritis, anxiety, panic attack, maybe some trauma, shingles. And they said, okay, doctor, then now according to this patient, how will you manage him? Okay, then actually I started like this, that first I will involve my supervisor and share all the findings. As this is a medical emergency requiring urgent actually needle thoracocentesis, I will reassure that the patient. I will reassure the patient and I will explain about his condition using the simple term. I will tell him the diagnosis as large pneumothorax and describe the procedure that about the needle thoracocentesis. Then I'll keep the patient upright position, provide supplemental high flow oxygen as needed. If it is like less than 95, target should be 95% of SpO2. Then I will after the after the thoracocentesis, I will keep my practitioner's bedside of the patient and tell her to monitor properly. Not paracentesis, thoracocentesis. I said thoracocentesis. Okay. Okay. And then I will offer again analgesic if any, I mean, pain severe. After excluding this, again I said this term, I don't know previously also, but again I said this one. And then I will explain about the condition to my patient that it's like air entrapment in between the visceral and parietal pleura. It is causing the compression of the lung and produce chest pain and need to remove the air to resolve your symptom. Like that I said. And then after and I also explained this way that after this I need to transfer you to tertiary hospital for further management. Then they are not just looking at me, then I started this way that I'll talk to the emergency register following ISBA protocol. I'll ask the patient if he wants me to call like her any relative or not. Then I'll do the secondary survey before coming. I told actually one more thing that I will tell my receptionist to call ambulance, and before coming ambulance I will try to monitor and stabilize the patient. After arriving that ambulance, I will provide the written documents to the paramedics along with the patient, and then that time they said actually that okay doctor, you sent the patient to hospital and now patient came back, what will be your post-discharge follow-up management? And then I started like this, okay, I will thank the patient for coming to me for follow-up, and I will ask for any residual symptom, like any residual symptom or any new symptom is there or not. I will ask how he was treated and check discharge summary and medication, check medical complaints about that, I mean, is he compliant or not. And I will activate GP management plan, and I will educate my patient and explain sensitively regarding the condition, especially possible attack in the future in the next 30 days, like that. And then I will advise lifestyle modification following SNAP protocol, give some other general advice like any avoid vigorous exercises, avoid air travel for next 2 weeks, and also avoid scuba diving for lifelong. And I will refer him for pulmonary rehabilitation, and then I will review him after 2 weeks to check the condition and order chest X-ray to assess full that it was recovered or not. And I will discuss the red flags like any excessive shortness of breath, again chest pain like severe chest pain, any other symptom, then please come back immediately or go to emergency department. Then actually they are saying that doctor, actually this question was little bit extra, or you can say that normally they are asking this way that okay doctor, how you will consider that this patient actually need to, I mean, what type of advice you should give. And I was thinking what I will tell actually, because I as what he needed and how many days he need to be in, I mean, like your review or something. Then I was thinking that what I will tell. Then I was telling that maybe I will continue this X-ray, taking X-ray, like if it is not improving properly, then again I will reassess the patient, and I will just repeat it some again this same symptom, like if is there any symptom persisting, then I will again send to hospital. Yeah, I think this is last one. I mean, this is the last. Is there any question, please? No, they didn't ask me how to do needle decompression. Yeah, the needle thoracosynthesis. No, they didn't ask.
Doctor, you are do needle sarcostomy, or you beside you and transfer? What you do?
No, I was saying that as this is after doing thoraco. Oh, even I forgot to mention that everybody will do, like when we'll do the thoracosynthesis, I will involve my supervisor, and with his supervision I will do this all these things, and then I will for the further management I will send to hospital. I said like.
Okay, he asked about when you can fly it for how many weeks, when you are like this.
No, that already I said that I will tell him not to fly for next 2 weeks, and scuba diving for lifelong, not to do any scuba diving.
Thank you, Doctor.
I said needle decompression, Dr. Stanley. Yeah, I said needle decompression.
Okay, but this is not a case of tension pneumothorax, because the vital signs are stable.
Yeah, vital sign was stable and no tracheal deviation, but it was huge tension pneumothorax. Huge pneumothorax. I just said that I will do the needle decompression, and for further management, I will send to hospital. No, I said needle decompression.
Yeah, but I was thinking the only one you can do needle decompression is for tension pneumothorax. Other ones you can do aspiration before, if your facility does aspiration before transferring to the hospital.
No. When it was like you see, as the X-ray, it is similarly like this. You see, it's a huge pneumothorax, but tracheal deviation is not there. I said that I will do needle decompression. They didn't say anything. And I told I will take my supervisor with me. And most of the time, whenever I was little bit confused or anything, I just involve supervisor all the time. All the time. They are saying, okay, doctor, you don't have to involve all the time. It's okay, you can continue. This way also they said in between.
Okay. Maybe.
Yeah, tell me, please.
Yeah, so because I'm thinking maybe saying about your supervisor, you refer to your supervisor was helpful in this case, since this shouldn't be decompression.
Yeah, I said decompression, and with the help of my supervisor, I'll do this procedure.
Okay.
And then after decompression, I'll send to hospital for further management. I didn't keep with me this patient.
Okay.
Okay, and then next question, I'll go to next question. That is ankle sprain. I'm sorry, maybe
okay, in case of
Yeah, please proceed on.
In case of pneumothorax, you did not mention that you will follow DRS ABCD and then everything. Yeah, you just said that I will send to the hospital.
Yeah, actually, what I did, first question was asthma case, right? I did DRS ABCD protocol. Then this one having chest pain, but I twisted. Actually, I said that I will do a primary survey and everything with DRS ABCD protocol, but I will not do DRS. Protocol I said, but I will. Okay, I said that as DRS ABCD protocol, I will assess the patient, but after assessing, if the patient is fine, I will go for further history, because first already I did one emergency case. DRS ABCD protocol, then I just turned to this way. I didn't do DRS ABCD protocol here, and they didn't.
At the end.
Yeah.
At the end, also, you did not mention that you will call ambulance and send the patient to the hospital. You just said, okay, I will arrange, I will send this patient to the hospital simply, right?
No, I said that I will call ISBAR protocol. I mentioned you. Maybe if I'm not wrong, I really mentioned that following ISBAR protocol, I will call emergency and tell to receptionist to call ambulance.
Okay, thank you.
I said that, yes. Okay, then next question I'm going. Is that fine? Actually, it was that child, that name was Luke, 15-year-old basketball player, brought by mother for medical certificate for training. Actually, previously we never heard that for training they came for the medical certificate. Here I saw this. They mentioned for training only medical certificate came, and history was twisted ankle 2 days ago while playing. She is having penicillin allergy. Immunization history was blank actually. Then asked for further history to take. Then I started like this, that actually I'll introduce myself, greet Luke and his mother. I'll check his stability and offer to lie down on the course to be more comfortable. I will assure confidentiality and build a good rapport. And sensitively, I will ask them. Actually, sorry, it was I'm saying wrong now. I'm sorry. Then I will explore ideas concerning expectation. Start history with open-ended question regarding this injury. Then I started taking history with firstly I will ask the severity of the pain on the scale like 0 to 10. If it is severe, then I will offer painkiller after excluding allergy to the painkiller. Then I will ask that okay, is he able to walk right now or not, and what happened exactly in the basketball area, what was the mechanism of this injury, was it fall actually from height or trauma to any other place, any others, trauma by others, and then any penetrating or laceration injury was happened or not, was he able to stand up immediately on his leg at that moment or not, and then was there any audible sound like popping sound or cracking sound, any injury anywhere else in the head or back or knee or any other places. Then I was asking that what is the exact site, actually exact site was where, like it was, which area, like which ankle, or it was mentioned, but I was telling this way, then they said it is already doctor mentioned, you can continue. This in between they said this word. Then I was asking about any swelling, bruising, deformity, any any it was any sudden or gradual, is it for the first time or not, how is that, like any dull aching pain or tearing pain or any sharp pain, any what about the character of the pain, like is it on and off or constant, if it is not constant, then how frequently, and is it related to any specific time during the day or after any specific activity, is the pain present or at rest, is that pain wake him up at night?
මොකද්ද කරන්න ඕන? සෙල්ලම hide and seek ද?
Hello.
ඇඳේ ඉඳලා එකක් කරමු.
Can you please mute, please? Okay. Then I was telling, then is the pain at the rest or not? Then does the pain wake him up at night or not? Any change or progression over the time? Is that getting worse or not? Any radiation to anywhere else or not? Then anything makes it better, or like applying warm compression or cold compression? Is it affecting his daily life and work? And how he is coping with this symptom, this pain. Then associated symptoms, I was asking like any fever, chills, rashes, any history of same injury before. Then I was telling in between that as my patient came for the medical certificate for training, I would like to know more about that. Exactly what is the exact reason? Like, it is for training? I can see, but what type of training? I was asking this way. Then I was asking about the vaccination and immunization up to date or not, and then I was asking about the general health, something like, and is there any weight loss, any change or change in appetite, night sweats, any lumps or bumps? I think this is the one in the history I was finishing up to this, and then they said, okay, doctor, this is the finding. Fallen during basketball practice. Now mild pain and swelling, no redness, can weight bear. I mean, he can bear the weight. No fever, no other symptoms. How will you proceed with the examination? And then I was actually telling that I'll follow the standard protocol, observe general appearance, measure vital signs, and check the growth of Luke. And I mean, actually, how he is. I mean, growth of Luke. No, actually, growth of growing of that injury area and is swelling or not. Then my focus examination will be ankle joint and foot. For ankle examination, actually, I was examining is he having weight bearing ability, and what about the gait of my patient. After that, I'd like to expose the ankle and inspect any bruises, deformity or swelling is there or not, and I would like to palpate for any raised temperature, localized temperature or bony prominences or any ligamental swelling or injury. Then I would like to do some active and passive movements of the joint, like one joint below and one joint up, like that I was saying. Then I would like to examine sensory and motor function of the ankle joint to and also like endovascular examination also I'll do, and I will not forget to do the examination of Achilles tendon with Thompson test, because it might be the cause sometime. And then I'd like to, actually I didn't mention exactly that Ottawa ankle rules. I just mentioned this way that I will check the lateral and medial part of lateral malleolus, and then navicular bone in the medial part, and in the lateral part base of the fifth metatarsal. I was telling this way, and then they were asking what type of test, other test you will do. In between they asked this question. I think I didn't mention here. Yeah. Yes. And then I was thinking what I will mention. Then I was mentioning this anterior drawer test and lateral talar tilt test. I just said these two things. And they said, okay, how will do this actually anterior drawer test. Then I was saying that I will keep the knee like 90 degree of flexion and the muscle relaxed, increase laxity compared to contralateral ankle reflex injury, and I forgot the exactly now name. That time I was remembering that like CFL and ATFL, the tendon. I was just giving this way. Then they said, it's okay, doctor, we'll go to next question. And next question was that that actually, as I said, that focus examination, they said that mother is against vaccination. How do you explain to her? Okay. And then I was telling actually that I will first involve my supervisor, sharing all the findings of history and examination, and explain to my patient and his mother and about the condition in a simple word. Then I will explain that this is called actually ankle sprain, and it's a common musculoskeletal injury that involves partial or complete stress or tear to the ligaments, but don't worry, we can manage it together. Then I was telling mother that please, like what was it? I think I said wrong. Yeah, I think I am saying management one actually, as mother was actually not that, and I was telling actually, sorry, I'm so sorry actually. Then I was saying I would like to involve Luke in this discussion when I was talking to the mother, and meanwhile I will check his GLIC competency throughout the whole session. Okay, thank you so much for understanding. Actually, I was thinking in the management part I was going. Anyway, and then I'm going to explore underlying concern and potential obstacles for this decision and check the health literacy and level of understanding of my patient and his mother about the vaccination. And I was telling that I am going to provide some about the benefits and drawbacks of receiving vaccination. I will explain how. Okay, just a minute, who is saying? Yes, I'm sure. Actually, I'm forgetting the things what I said that time, but it's more than a month, I think now. Nearly month is. So thank you for understanding. Actually, then I was telling mother that I'm going to provide some benefit and drawback of receiving the vaccination. I will explain that how crucial it is actually for the community and how important it is for Luke to prevent some other infections. I would like to reassure that my patient that actually there are lot of evidence-based research that support the benefit of vaccination and the harms that you are saying actually. That you are thinking would not happen actually. I'm going to explain that Luke doesn't receive the if Luke doesn't receive the vaccination, some government services and subsidies will be restricted for him. And then I was also trying to tell something, and that time they stopped me and they said, okay doctor, we'll go to next question. And they asked me this, like management actually not mentioned that way, but in between I was telling just this way that then they are asking that okay, Liu came back to you alone after 3 months of symptoms, and he's better now. Ask for immunization, willing to start vaccination schedule, and what would you do further? Then I again repeated this thing that I will I will try to actually find out about his concern, actually what he is thinking about this. I will check again GLIC competency, but I am going to check the level of understanding and checking if he has any other consideration or any ability, how he's able to consider these other various options, and is there any impact happen to take his decision, any other person forced him to take this decision. And then if I feel that if he is competent, then I'm going to administer the vaccination of my patient, and then asking him to share the decision with my family, with his family, sorry. And if he is not competent, then I'm going to arrange a family meeting to provide more provide more information about this, and I'll advise for catch-up vaccination. But lastly, I said that if after that also I will tell my patient that whatever it is I'm going to give, but you have to mention your parents, like either your father or mother, both of them are having same views or not, you have to share with them. And this way this case was finished. They didn't ask me again anything. Is there any question? I think I couldn't get that time actually. Yeah, I couldn't get that time. And you know, actually, main thing is, main good thing I will tell for me, because when I was telling something, I was not very fast, right? I was talking this as I am saying now, same way, and they were telling me, okay, doctor, don't worry, we'll go to next question. We'll go to next question most of the time. They didn't ask me cross any question like that way that I heard in, I mean, previously several this feedback that they used to tell that so many cross question and things, but they never asked me that way any cross questions. My advice it is yes, yes, yes. Yeah, I couldn't get time those things. What I mentioned now that only, but I think I forgot one thing. Maybe they were asking some one minute. They were asking some. I think. Uh, Yeah, I think some differential diagnosis they asked. I exactly forgot, but as I remembered little bit, maybe they were asking that way. I mean that question. Then I was telling something like, as it was ankle sprain, I was telling maybe it might be traumatic ankle, ligamental injury, maybe some tendo Achilles injury, any stress fracture, something like that. I said. Actually, this question, yeah, this question I forgot. Other thing they didn't ask. No, no, no. I was telling actually by mistake. I was telling sorry for that. Actually, that I was in mother. I was thinking I was telling this way. Actually, management was not us, but I involved during this mother explanation. I involved my supervisor, and I was telling about the condition, and I was not giving any management about that. Actually, that like price protocol normally we can give, but I didn't tell that time. Okay, thank you. Is there any other question, please? Then otherwise, last question I'll go. And please forgive me because after this exam, I was totally busy with my child and I was not having any time. And really, I forgot so many things. Maybe something I'm missing, but I will tell you one thing that please don't be panic. I was talking this way, exactly this way, and they were not telling anything wrong. That even I couldn't complete all the history taking, all the things, whatever they were asking. But anyway, if I think what I feel, if you are able to tell whatever needed according to them, it was fine for you and fine for us. And I even I will show you my exact feedback they given. That also I will share with you. It was really no negative comments. Can I go next question? Okay, I'll go to next question. Last question was actually for me it was breast cancer. I will post with you. Okay. Yeah. Actually, first they were this question. They were actually asking like patient name was Katie, 49 years old female, shop assistant, and worried about lump in her left breast. There was no history, I mean allergy, step allergies, but had a sinus surgery 10 years ago. She is single, sexually active, And father was 73-year-old with hypertension, mother 72 years old, breast cancer. Actually, it is not 48. I'm sorry, it was in 58 years old. Breast cancer diagnosed for mother, and done excision and radiotherapy given actually. And patient is non-smoker, CST done 2 years ago, and other things are normal. They asked me to take further history. Okay, then I started, as everybody knows, I think I have taken long time. Should I go through all like introduction part? I was just saying that I will introduce myself, thank panel, greet, and show the empathy, assure confidentiality, build a good rapport. I will explore ideas, concern, and expectation. Then start history with open-ended question. Then I was asking about the history of lump in the breast, like exact site. Where did you? I mean, I was asking this way, that where did she notice first time? Is it unilateral or bilateral? Is it mobile or fixed? When did it start? How did she notice it first? What was the size? Any change in size since the beginning? Like, I mean, any changes with the size? Yeah, if there was, then what was the rate of growth actually? Was it getting worse? Is it hard or soft? Mobile or fixed? Is it painful while touching? If yes, then any radiation, sorry, not radiation, any relation with the periods, and then any other lumps in the breast, feeling warmness or heaviness. Then I was asking about any skin changes on her breast, areola, any nipple changes, any swelling, redness, ulcer, any rash, any nipple discharge. If there is a discharge, then what is the color? Was it from, if it is there, then was it unilateral or bilateral, like that also I asked. And is it first time or not? Any consultation done before? Any investigation or diagnosis or treatment taken before? Any specific concern she was having? Is this I mean lump affecting her daily life and sleep? How is she coping with that? Any history of injury or trauma to the breast, recent any breast infection, like then any fever, chills, rash, I mean associated symptoms, as you know all, like fever, chills, rash, nausea, vomiting, dizziness, headache, any bone or body pain, joint pain, stiffness, easy fatigue, tiredness, weakness, any polyuria, polydipsia, polyphagia, any chest pain, shortness of breath, palpitation, any color changes there or not, and any, like what about her appetite and things, and any lumps or bumps anywhere in the body, any nitrate. Then I went to directly, I didn't complete all. Then I asked for 5 question, like what is the last menstrual period, irregular or regular? Is it heavier? I mean, scanty amount? Any recent change with her period or not? Then sensitively I will ask some personal question, like as it is mentioned actually when I was saying that sexually active, but I remember again that it is mentioned already she is sexually active. Then does she have any stable partner or casual partner? Is he supportive or not? And like does she and her partner even ever been diagnosed with STD or not? Any symptoms in her partner or not? Then what type of contraceptive she is using, like it is oral contraceptive or any other thing. And then as it was, I saw that screening test done 2 years before. I didn't, I just mentioned that I have seen that she is having cervical screening test 2 years before. Is there, and family history also there, that also I just mentioned. Then I was asking about like alcohol, smoking history, any what immunization status, and mood and sleep I mentioned already. And then they were asking me that actually they gave me some finding here. You can see that uh, yes, breast asymmetrical. Uh, No, this thing asked actually afterwards. I mean, there are. Oh, no, I'm saying